Hello everyone. Thank you so much for inviting me in such a wonderful conference, the International Conference on Traditional and Alternative Medicine. So I think this is not the first conference, but it might be multiple conferences they are organizing. But I think this is the third international conference on traditional and alternative medicine. As I am also in the field of traditional and alternative medicine, so I am highly grateful to all of you for inviting me in such amazing and wonderful conference. My name is Hamid Rasool. I am from University College of Conventional Medicine, the Islamia University of Bahawalpur. I am an international trainer, career counselor, peace ambassador, acupuncturist, hijama therapist, or we say that cupping therapist, and also I am studying Ayurveda, so we say that reflexology and aromatherapist also. I am almost given more than 80 sessions on traditional and alternative medicine and career counseling, peace, SDG and sustainable development goals, and many more other sessions. I am also organizing various international conferences such as First International Conference on Traditional and Alternative Medicine organized by International Internship University. I am currently the founder and CEO of Zenith HR Eastern Medicine platform, where we are exploring in the Eastern medicine. So we said that all those traditional systems of medicine that are practicing in the Asian countries or Eastern countries. So my focus is to all the knowledge that I gained from various speakers, from various trainer, counselor, educators. I would like to transfer all my abilities, my knowledge to all other people that are seeking the knowledge of traditional and alternative medicine, SDG and all others. So in today's conference we will focus on Rosa Damascena, and this is basically a natural medicine that has been used for the purpose of various disorder in the natural system of medicine. So we say that the traditional system of medicine. So in this conference I will focus the pharmacological action and ethno medicinal uses of Rosa Damascena in relation to sustainable development goals, mean that all the SDG, how Rosa Damascena contributing into the sustainable development goals. So that would be our main focus, and all the pharmacological action we will study in detail each and every one. So this is the data is taken from an article that I had worked on it from the last 3 months, which is the pharmacological action and medicinal uses of Rosa Damascena, a sustainable approach. This was an article that I worked on it, and that would be amazing we will be discuss each and every one in detail. So in this presentation we will focus the main thing that it not be too lengthy. It would be an easy and most effective way that each and every participant that had participated in this conference. So we will focus on main things, that how easy you can understand the presentation of the Rosa Damascena. So that would be an amazing one. So kindly focus each and every one. That would be really interesting and insightful, that you will know the world of natural medicine, that how natural medicine contributing into sustainable development goal and your health, how you can maintain your body, mind and soul with the help of Rosa Damascena. That would be our main focus. So first of all we should know that what is Rosa Damascena. So Rosa Damascena is basically we said in Urdu or in Hindi gulab ka pul, ठीक है. So that is basically Rosa Damascena, and alternative names are almostly used because in this conference there are many participants that would be participating in from various countries. So for them, it was firstly used in Iran for the treatment of various disorders. So that they call them as a Gule Muhammadi. So in Iran that was firstly used, or they are also calling them as a kings of flower. So that is an amazing. In our Eastern medicine, temperament is very much important when you are diagnosing a patient or when you are giving any herbal drug to your patient. So that is very much important because temperament is the main thing of your Eastern medicine diagnosis. So if you are an Eastern medicine practitioner, that is very much important, or Unani medicine practitioner, so temperament is very much important. So the temperament of Rosa Damascena is cold and dry in second order. Okay, if you want to know about more about the temperament, so you can connect with me, you can visit my YouTube channel and there are my website where there is more stuff on temperament, so you can easily understand that one also. Family is Rosaceae and local name is Gulab, that mostly in our Hindi and Urdu mostly they are using. And parts that used for various health purposes, that flower, petals, or we use the rose, we say Arke Gulab, that is basically also used. Okay, cultivation, we say already we know that in garden, houses, etc. for the purpose, used also in perfume and food industry, and also it is used as a medicine from the last 1,000 years. Okay, and it is cultivated all around the world. Okay, such as Iran, Europe, Bulgaria, and all other countries in Pakistan, India, that is mostly cultivated. And if we know the morphology of the Rosa Damascena plant, so it is a perennial herb. It have a bushy shrub and with 1 to 2 meters in height. And the flower of this plant is as here is in this picture is large showy flowers. 5 to 7 leaflets are connected with that one. Habitat, we said that America, it was found that in America fossils that it was 30 million year old. That is basically the habitat. And the mask rose, it was used in Iran and was known, as we said that the first they were known from Iran. So it was in the Middle East in Iran that they are using as a damask rose. It also be used as a fragrance oil in Greece. It is in aromatherapy. We are also using that plant. The oil of that plant is mostly used. If we know the phytochemical constituent of this plant, that why this plant is playing a role in maintaining various kinds of diseases or various kinds of health problems. So basically, because of these constituents, they are acting on specific cells or receptor for the purpose of to treat a various kind of disease. So terpenes, we will be discussing each and every one when we are going in detail of pharmacological action. Glycosides, flavonoids, anthocyanins, carboxylic acid, myrcene, vitamin C, linalool, carotene, gallic acid, camphor and quercetin. If we are focusing on essentials oil, that mostly in aromatherapy that we are using, so beta citrinol, nanodecane, geraniol, neurol. Okay, they are basically the phytochemical constituent of this plant that because of these phytochemical constituents, we are using various practitioners are using them for the purpose of to treat various kind of health problems. If we are in analysis that how this plant, how we confirm that it contains camphorol, quercetin, gallic acid, what are the method and how we are measure them. So the method of analysis of these plant. So an extract has been taken of menthol extract, menthol extract was taken of this plant, and the compound were present camphorol, quercetin, gallic acid, but not well known that which one is present. But how we measure them that it play a pharmacological effect? It was found that alpha glucosidase inhibited by these chemical constituent. When we were taken in a menthol extract and given to a patient, and it was inhibited, it inhibited the alpha glucosidase enzyme. So basically alpha glucosidase inhibition result in the anti-diabetic action. So we will going into detail of this each section. Ethanolic extract was taken that was containing volatile oil, that was found that it contains volatile oil, and it act on beta adrenergic receptor. Okay, how this beta adrenergic receptor act as a bronchodilator? So acting on beta adrenergic receptor, the effect of this plant, of the ethanolic extract of the plant, the action was bronchodilatory action. The next one is methanol extract. They are saying that citral, geraniol or neural that are present. Okay, that this method we measure that this an antibacterial action of this plant. Chloroformic extract was taken and very long fatty acid, which inhibit the beta amyloid beta, which is a degenerative protein. Okay, neurodegenerative protein. So what does it? Protective effects on nephritic atrophy. So it was the measurement that how we can measure the extract and given into the patient, and how we can measure the effect of this plant. Okay. So the first pharmacological action is regulating functional infertility. So the constituent present in this linalool act on hypothalamus, which act on GnRH, GnRH hormone. Okay, gonadotrophin releasing hormone, which act on anterior pituitary and stimulating the follicle stimulating hormone. And due to GnRH action on anterior pituitary act, it result in the secretion of FSH and LH, luteinizing hormone, which act on ovary, which result in the follicular development. So this is the first pharmacological action because of the linalool constituent. And the second one is the regulating menstruation. It has been used from thousands of years for the regulating menstrual health. Okay, so linalool, the same thing, is present in this, act on anterior pituitary, increase the FSH secretion. Okay, because stimulating the anterior pituitary cell, it secrete FSH. Due to FSH secretion, because as we said that FSH and estrogen are the same. If you are increasing the FSH level, the estrogen level will be increased. So estrogen level is increasing. As we know that in female, estrogen play an important role in ovulation. So ovulation is started, and ovulation is induced, induction is started, and then due to induction of the menstrual cycle, it results in menstrual regulation. So basically, it is very much important constituent of this plant, linalool. And anti-diabetic action, as we say that alpha glucosidase inhibition, but we don't know that which one is the main one. Okay, the camphorol or quercetin or gallic acid, but not exactly known from various research paper that which one is playing the main role. But these three, among these three are, all these three are one of them playing acting on the glucosidase. What does glucosidase do? As we know that starch is converted into maltose and glucose, and the increase in the blood glucose level result in diabetes mellitus. So basically, how this enzyme glucose, the main function of glucosidase is to convert starch into glucose. Okay, so how does the camphorol or quercetin that is present in this plant inhibit the glucosidase enzyme? So if glucosidase enzyme is inhibited, so the blood glucose level will not be rise, because starch will not be converted into glucose. Okay, and then if glucosidase is inhibited, so there will be no absorption of carbs or glucose from small intestine into blood vessel, because from small intestine the absorption of all nutrients are from small intestine. So the glucose will not be absorbed into the vessels. Okay, then if glucose is not absorbed, so blood glucose level not be rise, so the postprandial glucose level will be decreases. So decrease in the glucose level will be the anti-diabetic action. Okay. Number 4 is the anti-hypertensive effects of this plant. That is very much important. It contains a special chemical constituent which is cyanidine 3-beta glucoside. What does it do? It inhibits the angiotensin converting enzyme. Inhibition of angiotensin converting enzyme will results in the inhibition in the angiotensin 2 formation. We said that what does angiotensin converting enzyme do? That it convert angiotensin 1 into angiotensin 2. If angiotensin 1 is not be converted into angiotensin 2, so no stimulation of angiotensin receptor. So if there is no stimulation of angiotensin receptor, so there will be no blood dilation, means that blood vessel not be dilated. If blood vessel is not dilated, this means that blood pressure will be decreasing. So it is the main function of this plant, that it contains cyanidine 3-beta glucoside which inhibit the angiotensin 2 receptor, that not result in the dilation of blood vessels. So it play an important anti-hypertensive effect. Number 5 is anticonvulsant effect. The flavonoids, mostly in aromatherapy it has been seen that flavonoids, maybe it a geraniol or eugenol, not well known that which one constituent is basically playing the anticonvulsant effect. What does it do? It enhances the effect of benzodiazepine receptor. Okay, it increase the effects of benzodiazepine on GABA receptor. Okay, GABA receptor, due to increase or enhancing the effect of benzodiazepine receptor on GABA receptor. Benzodiazepine on GABA receptor, basically benzodiazepine are protein. okay, on GABA receptor. It increases the binding of GABA to alpha 1 receptor. As a result of increase in chloride channel opening. As chloride channel open, the affinity of GABA on neuron will be increases. Okay, as the affinity of GABA on neuron is increases, the chloride channel conduction will be increases. Mean that chloride ion will be influxed into the neuron. Mean this is basically a channel, as we know that this is basically a channel, and from above there is chloride channel entry. If chloride channel is more entered into the neuron, what does it cause? It result in a small hyperpolarization. As hyperpolarization resulted, it carry action potential away from the neuron, that in convulsion it was hyperpolarized. Okay, but a small increase in the hyperpolarization will carry the hyperpolarization or action potential from the neuron, away from the neuron, which result the neuron will be repolarized. So basically what does it do? That the hyperpolarization and again hyperpolarized, due to which the action potential will going away from the plant, away from the neuron. So as the hyperpolarized state of the neuron is changed, it will result in the repolarization and the neuron will be in repolarized state. Okay, so that is basically the anticonvulsant effect. Okay, and the next one is hypnotic effect. Ethanolic aqueous extract was taken and it found that it contained flavonoids or terpenes or maybe both. It increased the affinity for central benzodiazepine receptor. So basically a benzodiazepine receptor affinity is increases because of terpenes or flavonoid. It show a hypnotic effect. So that is very much important. The seventh one is analgesic effect. Quercetin or camphorol, that was first we discussed that it play anti-diabetic effect. So quercetin or camphorol, but it should be found that it non-soluble in water chemical constituent are predicted. They shown that a non-soluble water chemical constituent were predicted. Basically these were camphorol or quercetin. It show analgesic effect. So that is very much important. And bronchodilatory effects. Okay, volatile that are present in the Rosa Damascena, or you are extracting from the leaves of the or the flower of the Rosa Damascena. What does it do? Upon inhalation, as in aromatherapy, we are giving essentials oil to the patient and give them to inhale it. Upon inhalation, it stimulates the beta adrenergic receptor. It increases the smooth muscle relaxation and increase the mucus secretion. So it play an important effect as a bronchodilatory effect. Protective effect on neuritic atrophy. Chloroformic extract was taken and very long fatty acid was found. What does it do? It inhibits the amyloid beta, which is basically a neurodegenerative protein. What does it do? Neurodegenerative protein is inhibited, so no degeneration of neurons will be occur. So no degeneration, so no pathology like Alzheimer and Parkinson will be shown. So in this patient, it was in aromatherapy. It was practiced that basically it play anti Alzheimer and anti Parkinson effect. So basically, it is a neuritic atrophy protective effect. So this is also important. And the main thing is that we are going to discuss that how Rosa Damascena is playing an important role uh, in a sustainable development goals. So we know that good health and well-being is an SDG 3. So Rosa Damascena is used traditionally from thousands of years. So it play an important role in good health and well-being. So it ensure healthy life and promote well-being for all types of ages. Okay, Rosa Damascena contribute to the goal because of its medicinal property. We are treating various children, we are treating female patient like menstrual disorder or men treated by, this is the main use. Okay, and all other anxiety, depression, the oil that we are using in aromatherapy, it play an important role in maintaining good health and well-being. So it is one. Number 8 SDG in relation to Rosa Damascena. It promotes sustained, inclusive and sustainable economic growth, full and productive employment and decent work for all. Okay, because it supports sustainable livelihood through cultivation and trade, and trade and cultivation results into economic growth. Okay, and economic growth is increases. You can also relate with the employment, that if you are using on your own clinic because of this oil or other oil in aromatherapy, you can adjust various kinds of employee on your own clinic. So it is also playing an important role. But the main thing is the trading and the cultivation of these plants. Number 3 is goal, sustainable development goal 12, responsible for consumption and production. It ensures sustainable consumption and production patterns, because Rosa Damascena is used in sustainable practices, because traditional medicine is a sustainable practice, like in eco-friendly cosmetic, it is used for various kind of face disorders like pimples, okay, and others, for other also. So in various cosmetics, herbal lotions, herbal creams, it is used. Okay, so it is also important. The next thing is the life on link. It protect, restore and promote sustainable use of terrestrial ecosystem, forest and biodiversity. Rosa Damascena conservation and sustainable cultivation support ecosystem health. So it is also important. If we are using ethno medicinal, it is used in various traditional system of medicine as a laxative, anti-diabetic, antioxidant, anti-inflammatory, antibacterial, blood purifier, analgesic, anti-hypertensive, analgesic, also an anti-tussive. So bronchodilatory, and you can anti-diabetic, that are used in sustainable practices of traditional system of medicine. Okay, so there are various products that are being used for the purpose of various kinds of disorder, such as Majun Tabidul Ward, Arke Amber, Arke Gulab, Garlina, the Bowel Mess, Afti Muni, Masturin, basically that for menstrual disorder, and our other you can see here. So this was the my presentation, and I am highly grateful to all of you for listening me in the 3rd International Conference on Traditional System of Medicine and Traditional and Alternative Medicine. I am highly grateful to all the organizer and various amazing listeners and speakers who they are participating in this conference. So here is my contact number, and you can also email me, or you can visit on various platforms such as LinkedIn. I have also my website, Zenith HR Eastern Medicine platform, and LinkedIn, Facebook, WhatsApp, and I am training various kinds of students in traditional system of medicine, Chinese medicine, acupuncture, aromatherapy, moxibustion, and Eastern medicine, Unani medicine. We are training various kinds of students. If you have some issues regarding Eastern system of medicine, you can contact with us and we will solve your problem. Thank you so much. Thank you so much.